Welcome back, everyone. Today we'll talk about gastroesophageal reflux disease. I figured since last time we were on Crohn's and ulcerative colitis, we'll continue along the same GI tract, and today we'll talk about GERD, which is a shortened form for gastroesophageal reflux disease. And this occurs because you have an inappropriate relaxation of the lower esophageal sphincter, less for short. Now, because the esophageal sphincter is relaxed, when you eat and the food goes in the stomach, you have enzymes and acid that is breaking down the food, and the food now goes back. This acidic content goes back up into the esophagus and causes inflammation to this very sensitive area. So some causes that can is related to this is you have gastric or duodenal ulcer, you have gastric or duodenal surgery, there is obesity, smoking, prolonged vomiting, or hiatal hernia. And bear in mind that hiatal hernia can occur with or without GERD, so they don't necessarily occur together. Those are just some causes. Another causes that can affect the pressure or foods, such as peppermint chocolate coffee, any fried foods or carbonated drinks, and of course, drugs. Some drugs, such as the anticholinergics, they delay stomach content and they cause relaxation of the smooth muscle. And I've listed a couple of those medications here that are related, just to give you an idea of what these are. There's so much more that you can, as you're reading, just pay attention to those. Clinical manifestation that you will see with these patients, or what they will complain about. The most common is heartburn. So they'll describe burning or tight sensation in the lower sternal area and spreading to the throat or jaw. And this mimics angina. So if you notice the pain that is spreading to the throat or jaw sounds similar to if somebody's having some form of a heart issue, correct? Right. So you want to make sure you pay attention to that. And just because both share the same symptoms, don't assume it's GERD and not follow up, because you'll hear hoofs and you think it's horses, but it could be zebra. So you want to do a thorough investigation. But one way you can do that is to administer antacids. If the pain goes away after you've given the antacid, more likely than not is coming from GERD. And of course, you also listen to the patient's history and relate the two and combine and see what the patient is having. But just in case it's GERD, these are some symptoms that they'll have, along with dyspepsia, nausea, regurgitation, coughing, lump in the throat, feeling like they're choking, and increased saliva. How do you care for these patients? So first, it's a lifestyle modifications. By doing some of those things, they can relieve their symptoms without more drastic action. So lifestyle modification, you want to start low, right? So the lowest intervention is always good. And these are teachings you want to give to patients after they're no longer in your care, because once they go home, you want to make sure that they're knowledgeable of their disorder and they're doing the right thing in order to relieve themselves of these symptoms. So a low fat diet. And I've listed some things that are in that classification. Now, when you are reading, you don't just read low fat diet. You must always go into details, because if you get it on your exam, let's just say they listed the foods on the exam, but they didn't list that it's a low fat diet. At least you're prepared, you're well equipped. You can answer the question either way they do it. And not just for exam, but also when you're taking care of your patients. You don't just say eat a low fat diet. Most people don't know what that is or what food is included in that. So those are the details you pay attention to as you are reading. Goes a long way and it's very helpful for you. Avoid alcohol, caffeine, smoking, and they must be upright 2 to 3 hours after a meal. And they also want to avoid eating 3 hours before going to bed. Elevate the head of the bed at least 4 to 6 blocks. Some literature said 6 to 8. 4 to 6, 6 to 8, either one, the head of the bed must be elevated. And also weight reduction, and they want to avoid tight clothing, especially around the waist, because that increases pressure and push the content up into the esophagus. So they want to avoid those. Some medications that are used are the proton pump inhibitors or histamine 2 receptor blockers. And on this next slide, I give you an example of what those look like. It is impossible for you to memorize all the medications out there. Nobody knows them. And I mean nobody, even the ones who are writing it. It's too much for you to do. But a smart way for you to study and know these medication is to put them in a class, right? Classify them. So if you notice the proton pumps inhibitor, Zol is at the ends of these medications. So pantoprazole, omeprazole. So you put them in this class, and these are proton pumps. So let's say, for example, you have never seen lansoprazole before. The fact that it has a Zol here, your wheels are turning, right? Oh, I think that must be a proton pump inhibitor. And because you've already known what it's used for, the side effect of it, you can easily answer any question with this medication that you have never seen before. This you want to take before your meal. And as always, everything you do for every intervention, you want to make sure that you know, is it working or not? Is there a side effects or not? So you want to know the side effects, and you want to know how it works and any complications that is associated with these medication, and they're listed right here for you. In nursing, what do you do always? You assess, you do an intervention, and you go back and you reassess, right? This patient comes in complaining of heartburn. You now are sure that it is GERD. So now you're going to do your intervention after you have taught them, after you've teach them lifestyle modification, and now you're putting them on medication. So those are your interventions. You have done all these beautiful things. You want to know, are they effective? So you go back and you reassess. That is just the way of healthcare. Assess, intervention, reevaluation, or reassessment. Okay. Next class of medication is the H2 receptor blockers. And once again, if you notice, it has a dene at the end, right? Cimetidine, famotidine. Those ring in your ears, whatever you need to do to remember those. So there are some things you have to memorize in nursing, and this will be one of them, those deans at the end. But in the meantime, you're memorizing them. You also know how they work and what you are looking out for. So that's how you take care of your medications that you're studying. NCLEX testing you on generic, so they're here in generic form. And antacids, these give quick relief of symptoms. They neutralize the acid. You take them 1 to 3 hours after meals and bedtime. And be cautious in older patients because it increases sodium. Sodium loves water, and hence building up pressure. You have hypertension. You want to look out for these patients for hypertension or those with renal disorder. You don't want to have increasing electrolytes if they're having difficulty going to the bathroom. Nutritional therapy, and this continues along your teaching line, and these are the things you will teach them. We've already revisited the food, so you'll teach them those things and encourage the small meals, and weight reduction doesn't hurt at all. So you want to teach them those things that will help them to relieve the symptoms that they're having. If all else fails, if medication didn't work, your lifestyle modification didn't work, it might lead to surgery. This is done under extreme cases. And one of the surgical procedure that will be done is called fundoplication. And this is where they wrap the upper portion of the gastric fundus around the sphincter in order to create make the lower esophageal sphincter more effective. And for these patients, you teach them before they go to surgery what to expect before and what to expect after. It helps relax them, it reduces anxiety. If you already know what is expected of you, you are less anxious and you're better able to handle a situation that you are entering in. Just like you looking at this information in order to prepare for the NCLEX. The more prepared you are, the less anxious you will be, the more effective the final result will be. So, as always, I bring a content to the table. You come, you'll review, you'll leave some question, and you'll bring your questions that you'll bring to the table. I'll see you next time on the next video, and you leave a comment on what would you like me to review next time.